I was particularly impressed with the list of speakers, both local and overseas, and to see the interest that people had in mental health issues. And I think that gave us a lot of optimism as we move forward. We have had, I think, a lot of discussions here, but we don't want this conference to be like a talk shop where talk about things and then nothing gets done. As I was saying to Professor Hoven, I think we should make this into an annual conference. And I think she's kindly agreed to do that. And therefore, when we come from one conference to the other, the next one, we should have some concrete things to report on. If we're not doing that, then I think all the nice discussions that we are having would not be very good. So we want to use the information that we're gathering at conferences like this and then put them into action. So the first thing I would like to say is that let us take what we have learned through these last couple of days. If we can do something like pulling all the presentations together, have it published. Now we can publish them online on YouTube. I think that would be a fantastic thing so that people can go back, look at some of these presentations. I know because some of them were running concurrently, you might not have been able to get to all of them. So this gives an opportunity for people to go back and look at them. And then, of course, you'll be able to participate fully when you look at all the issues. But more than that, I think we can also condense some of the information, these different talks, and to do maybe a printed handbook on maybe like abstracts of what took place, so that that is more handy for people to work with, and maybe that's something for us to consider as we move forward. I think that would be a very good way of getting the information, the recommendations from this conference, so that we can have a handy way to do this. And we can always go back and reference. So that would be the other thing I would like to ask us to think about as we come to a close of this conference. I think we also have, from the ministry side, from the policy side, we have some homework to do. One of the things that we were looking at is to make sure that we can create this enabling environment in terms of legislation. I spoke at the opening, I referenced two such pieces of legislation. One is the suicide prevention bill, and the other one is a mental health bill. Both of these have been in the making for some time. I think it's very opportune that we should move it to the next step. Those next steps would be getting it to Parliament as quickly as possible, and then getting it through the different stages, changing it from a bill into an act. Once it becomes law, then I think it would change the environment that we have here in terms of mental health. But while we work on legislation, there's also other things that we need to do. I think there is lots of opportunities for us to train people, and this conference itself has been an eye-opener, and a lot of the overseas partners have demonstrated interest in Guyana and in collaborating with us in many areas such as training. So we want to make sure that we grab these opportunities as they emerge. And so I think in terms of persons who are working in mental health, whether you're a medical doctor or you're working at another level, dealing with counseling or psychology or whichever area, I think we need to build capacity. And we need to use the opportunity of this conference, the linkages that we've made, to help us to build capacity for all of this. So that's something I think we have to work jointly on. to make sure that we improve our education, capacity building, and so forth. One of the things that we also must do is that we must get psychiatry more out into the community. So while there will be that shift of decentralizing our services, to begin with, I think at every regional hospital that we must be able to provide psychiatric services. And that's going to be a major change because right now we don't have psychiatric services at all over the regional hospital. So we have to work to get there. And then while we're doing that, I think, because when you look at our structure, we have what, 400 and something different post-health centers. We can train community health workers to do the very basic in recognizing persons with mental health issues. Right now, they're training, when you're training them, it doesn't have that component with mental health. And we can integrate a few elements of mental health training at that level. But also our physicians, our primary care physicians operating from health centers, they've had a challenge in terms of diagnosing people with mental health issues. A lot of times depression and issues like that go totally undiagnosed. One, because I figure that physicians are too busy asking persons about whether they're diabetic or hypertensive or whatever else, the more common ailments. And we don't bother to ask about things relating to mental health. And in doing that, we're missing a huge part of what we should be asking. And therefore, we really don't get to understand the patient in a full way. So I hope that we can address that gap when we do our history taking and so forth. We should have a component of asking these types of questions so that from early we can start making those diagnoses. If we are able to make the diagnosis earlier, then we can craft the interventions that we need. And I think if we do that, we'll start seeing a shift in a very structural way, a shift in some of the cases we're seeing. So that's one of the things that you have to do. You have to get a more comprehensive program of training our primary care physicians, primary care nurses, to be able to recognize this. In addition to that, I think there's room for us to work in the community. In the past, we've had some programs working in community to recognize mental health issues and for persons when they have these difficulties, they can identify persons within the community who they can go to. I recall many years ago we had a program 6 that was called Lifesavers, and that program worked well for a couple of years, and then I think it just disappeared. And I think it had value while it lasted, and probably saved a lot of lives while it lasted. But what were the reasons why it wasn't sustained, why it wasn't maintained? I'm not sure. So that's something, that's just one example, but there are other maybe such programs that we could develop and integrate them into the community. Because a lot of times, sometimes when people want to talk about these issues, they wouldn't come to a healthcare practitioner. They'll probably go to somebody of influence, maybe a pandit or imam or priest in the community where they can discuss these things. And if those persons are not properly equipped to handle these cases, if they don't offer proper advice, then they can do more harm than they do good. And therefore, we have to work with the people of influence in the community, give them the knowledge, give them the understanding, so that when they encounter cases like this, they're able to, to help us, to counsel the people, and then to move them into a clear environment. One of the other invisible, I would say, epidemics that we have here is really in substance abuse. And we have those that are illegal, and we have those that are legal. So we can categorize them in those two ways. The legal ones we tend to accept because they're available in the shops. We go buy a lot of alcohol. I think Guyanese consume too much alcohol. And we are socialized to use it from a very early stage. A lot of our sporting events, these things are available. And you can you buy one and you get one free. There are lots of happy hours. And so people drink beyond the legal limits. They drive drunk in many instances. And then if you do an analysis of the accidents, I would think that a lot of the persons who end up in accidents are because they're drinking and driving. And that's something that we can reduce. I think we have to expend some energies on that. But beyond that, it's the damage that alcohol will do to a person's system, the dependence that it creates. And we can look at in all of our communities and we'll see examples. And I think we really need to have a program where we can address some of these issues and educate people because we don't have a strong program in this direction. We also need to look at the illegal substances that people consume. And again, we know the vicious cycle that these things create. So people start using it, maybe experimenting with it, then they got hooked. And then because they're not working, or even if they're working because of their addiction, they lose their jobs, they have no money, then they go to crime, they commit crimes, they steal from people, and that cycle continues. They go to jail, they come out of jail, they're now, people don't want to give them work because of their background, and that cycle. We got to break that cycle. And I'm sure that a lot of you in this audience, you know persons in your community this would have happened to. And the rehab programs that we don't have it. So this is a big area that we have to work in. We have to develop more rehab centers or rehab programs so that we can help persons who right now they have these types of problems. So I think between now and the next conference, we have a lot of homework to do, and I would really like to work with you to make sure that we start developing some of these things. We might not be able to do a comprehensive program between now and next year, but certainly if we start and we're headed in the right direction, I think we're taking the right set of steps. And that's what I like to see. We'll also like over the next year to, now that we have an evaluation of the last 5 years plan of mental health, we had one going from 2015 to 2020. This year there was an evaluation that was done by PAHO. We have the results of that evaluation, so we have to use that as the basis, plus meeting with stakeholders like you for us to develop a new plan, but one that is more reflective of where we want to take this and solving real problems. One of the challenges that I see with a lot of our programs is that, we like to do activities. So we do a lot of activities, but are these activities having an impact on the problem? And in a lot of cases, the answer is no. So we spend money, we do activities, we might get some awareness about the issue, but then the impact on the problem is not there. So 1 year from now, 2 years from now, the problem is still here, and we haven't changed anything. I don't think we need to develop programs that are not going to change. We can identify the issues, we need to do so, and we need to figure out how to change it. And if we can do that, then I think we're on our way. And the last thing I want to talk about is that I think this is a good opportunity for persons who are interested in mental health for us to develop a broader collaboration in terms of research. We have not been very strong on research, But over the last couple of years, there's been a lot of interest in that, to do research, and we can piggyback on more established programs so as to learn how to do research and build the capacity to do research. There are many, many things here that we can do research on. You might not think that these things are important to the world, but we can do those research and demonstrate, all kinds of stuff that would be useful for other people elsewhere that may be grappling with similar problems. So let's work on this. I think it's very exciting. I'm excited about it. The field that we have, the interest that people are showing. I'm sure that we can change how we view mental health, destigmatize it, get more people into care, prevent persons who might have a tendency probably to develop mental health disorder. We can help to prevent some of those conditions. And, we all would be much better for doing all of this. So thank you very much. Thank you to the team. I think you've done a fabulous job in organizing in such a short period of time. And I think this can only get better. We're starting at this point, this will get better. And it is something that you will all look forward to in the health agenda of the country. So thank you so much.
I think we've heard our marching orders. I think we're all here, we're all attended, and all worked very hard during these 4 days to try to explore what it is, what are the problems, and how we might think about addressing them. We've had help from people around the world, experts around the world, talking to us about what we might think about doing, what we might think about not doing. But I think the end result is that we have an opportunity, as Minister Anthony said, to actually take action. And under his leadership, it's clear that we can make a difference. But making a difference is, just as he said, talking and talking and talking is not what doing. We have to take and make concrete changes, both at an organizational level and an individual level as healthcare providers and the community. We have to change behaviors if we're going to get anywhere. So before I go on, I want to first do a couple of things. I want to profoundly thank all of the people, and there are many, many people in this room and outside of this room, who made all of this possible. Minister Anthony is one of them, but there are many, many other people in this room who did the grunt work to make this happen. It didn't just happen, including the IT people of this institution. I mean, they were fantastic. At the very last minute, we arrived on Saturday, and then Sunday, and then Monday, here you were. So everybody gave their heart and soul to make it happen, and I am profoundly grateful. The other thing I want to do is to identify the people here at the podium with me, and I will have them each say a word about their experience and where they see us going. Then I want to come back and collectively talk about how we're going to take these concrete steps. We cannot leave here today without having a plan. And not a plan that's pie in the sky, but a plan that's actually concrete that we can do. And we have to have people step up and say, I will be responsible for that. Okay? We're not going to get anywhere if we don't agree that we're going to make changes. And that means we have to work. And next year we will come back and we will see how we're doing. And we do not want to be a failure. We want to come back year after year and see that we've made a difference. And it's going to be a long, hard climb. But we can do this. We can bring these suicide numbers down. We can impact, whether it's automobile crashes or it's substance use, alcohol, drugs. We can do this. But we have to do it together. And that's why we have such an interesting collection up here. And I will ask their decision. Sorry, because I really want to see a wonderful fall, so I'm going to give a few minutes. But I just wanted to congratulate. I think Christina, George, and her team deserve a big applause for what they have done. I think it's incredible that they have had such a time and doing I mean, her team here, her team in Colombia, they have been absolutely fantastic. All I want to say is that we have been as academicians to many conferences, but this is one of the most inclusive conferences I've seen. It has included researchers, it has included clinicians, it has included the community, it has included the religious leaders, and this is the way how the conference should be done. I don't know how we are going to make it better, but this is a but this is a very solid start. But all I can say is that we are all in this field to see how we can contribute in a small way to make this dream of making Guyana a really a well healthy, mentally healthy country and reduce suicide. And I want to publicly thank you for giving me this opportunity to come here. There were a lot of teachers to come here, but I'm so delighted I came here, and thank you for this opportunity.
Hello everyone. My name is Dr. Ellen G. Denton, and I know that the GPEG team knows that this is a dream come true. It is. We represent, I think this conference represents a diversified scientific community. You can look to the left and to the right of you, and you're probably sitting next to someone you didn't expect to sit next to yesterday evening. It's true. I am. That said, how the way forward, I think of two things. The first is we can begin asking the research question now with the persons who are surrounding us. We can begin asking, and oftentimes we ask those questions maybe to the wrong person, and that might truly happen. But you can keep asking your question. Ask the question, how to build, how do I design a research study? How can I contribute to a research study? Not everyone is going to be the writer. Not everyone is going to be the analyst. But everyone in collaboration with their different strengths and weaknesses can build something that can eventually be published, that can eventually build currency to do projects as grand as this. So I think the first thing is to use our community resource that we have right here, right now. Ask the question, and I think this conference represents that someone will respond. Someone can respond to your inquiries, and little by little, moving forward. We can do it. So use our resources. This is a community of resource, and that would be my first thought. My second thought is a little bit more individualistic, which by trade I'm a psychologist, so that would make sense. And that is to own your own projects. Our projects don't mimic one another, but I was able to sit and to speak with many people who are doing work on the ground, Mr. Drayton, Dr. Anderson at the Georgetown Public Hospital, Dr. Hover, other people, mental health unit, Alicia Solomon. I was privileged to sit and talk with many of you and hear your ideas from grassroots to University of Guyana administration, Dr. Paulette Henry. And so just hearing each of them, so many people have so many ideas of ways that they would like to move forward. And I would say own your project. And while you're owning your project, be a mensch and don't get hurt, right? Be kind and gracious and hear them out. It might not be a good fit. It might be a good fit, but own your project and move forward with it. So it's an onward and upward thing, not done in isolation, none at all, but using the capacity and the resources surrounding you. I do think that next year will look very different. And I definitely believe, because next year will look very different, that a decade from now, we would see differences in suicide here in Guyana. So thank you so much for your welcome. Thank you for your time when we have sat and spoken. And I look forward to what change is about to come in the years ahead.
Hoven, George, Ellen, and my colleague at the area, colleagues all, this has been an exciting time, and we really want to applaud you for joining with everyone else in saying that you did really well. And the overseas team, our local team, everybody just came together and we came to a place of diversity but unity because we all believe in a common thing. We want to be better. We want to be healthier. We want our society to be good, and well. And it takes all of us. It takes everything that each and every one of us bring to the table. When I had my conversation right in this room here, Professor Hoven challenged me, and she challenged me, and she pushed me to answer those questions as to how, what next, how more, what more can we do? And I think the minister started to answer that question for all of us, which has set a policy tone. But all that we have been hearing all along is that no one person can carve out our well-being. No one institution can carve out what that should look like. The university has a role to play, a critical role, and our vice chancellor started to talk to that role that we can play. And I wish to affirm that from our end, whether it's in social sciences or the health sciences, we are committed to making sure that we contribute to a society that people feel well, they feel belong, and they have a space and a place. But we cannot do it. We have parents sometimes who pressure children. And we've seen that in some of our programs where they want to be big and our examination and all those different things emerge and we see the challenges and the struggle. But we also see that there are opportunities where we can talk through things together if we work together towards common, goals and understanding of what wellness can look like. And so I want to be a part of continuing from not only the university end, but I'm very into grassroots and community connections. We, through social sciences, have a lot of persons in the field because of the work they do. Social workers and other students, they have their internships. And so we are able to do pragmatic work. But on the other hand, we are also able and there and ready to do the research. So we bring that. But I am a very hands-on person who want to be in touch and on the ground. I'm not happy with what we have currently in terms of our mental health system. So I was excited to hear that we're going to see psychiatrists in every hospital, regional hospital, referral hospital within the region. That's necessary. So I'm looking forward for that. But that alone, as was correctly pointed out, cannot help. We need, and I'm going back to Dr. Adu-Krow, to go back to that model where we use to combat the issues of HIV and AIDS. Every community had a process, a plan, and an action to address the issues. So it wasn't just from the ministry at the top at health. It was education, it was public service, it was every ministry having an agenda to address HIV. What are you doing in the workplace? What is happening in the community? It was every religious organization having a part of their conversation with their population. It was every space, private, public partnerships. They were working and functioning. We need that. Guyana has this space when we look at our beautiful country, scenery, the fauna, flora, and everything else. This is a country where people should be happy. We shouldn't be a country where we are in that ranking for suicide, and societal issues. This is a beautiful country with enough for all of us to be mentally well and to do well. But it has to start with each and every one of us, not the minister, not the president, not the religious leader, but you, me, our families, our children, our community. I thank you and look forward to working with you all.
Can I ask Alicia? I hope everyone has come to. It was hard to avoid Alicia because she was in so many sessions. She was demonstrating her leadership everywhere. She was eloquently speaking on many, many issues. She was introducing people. She was just an outstanding participant. And I hope everyone knows that she's recently been appointed by the minister as the National Coordinator for Suicide Prevention. She is your real companion, and I hope everyone knows to turn to Alicia. Leave me a little bit of time, please. Please feel free to turn to Alicia. She is taking on very seriously this national role. And, you know, we are going to bring these numbers down. And I dare say it will be great measure because of the work that Alicia will do. So now that I've set you up, you can't say anything.
I don't know where to start, but I must say that I'm committed to the call. And like Ms. Emily would have said, we are too small and too beautiful of a country to have so many people dying by suicide. We must do something, and the time is now. This conference would have come at a time that it is relevant, it is needed, it is necessary. And a lot of times we come and we talk, but I do not expect us to leave here and not say that I want to do something about this surge, this plague that is taking our nation. And we must be able to not only address it at our community level, but start with our children, our grandchildren, our nieces, our nephews, have the conversation with them and let them know that it is okay to come to me, and not only come to me, but share their stories. Because one of the things that I've known that a lot of times our children don't come to us because we judge them. We expect them to not have problems. Let me tell you something. Children do have issues, and they don't want to be told why you have a problem and you don't have any responsibility. They have responsibilities. We say children have rights, but we don't teach them their responsibilities. So we want to start with our home, start with our children, start with our family, and we move to our communities. And we need to have a sense of community that when we see something is affecting our community, that we want to do something about it. We really want to do something. And it might not be you might not be able to do something on your own, but you may know somebody who can do something. So don't feel free to reach out to that person, get a hand, get a shoulder, somebody who you know can help. Also, we want to change some of our attitudes and some of our languages. Change the way we address persons who might be impacted or affected by suicide, substance use disorder, mental illness. Change the way we address them. Change the way how we look down on them. Because a lot of times, some of them are not responsible for what they're going through. They were exposed and then they become addicted, or they were exposed and they have no one to turn to. And this is where they see the way out and they go to that way. And so we have to change those languages and change some of our attitudes and our languages and how we deal with persons affected by mental health and suicide ideation, substance use disorder. And I see us moving forward as a country, as individuals, as communities. And I would like to take this opportunity also to thank DrPH and the Columbia University team for coming on board and recognizing that this surge is affecting us and it's impacting us and bringing such a conference to us and really want to help us do something about suicide. So thank you again.
Dr. Moser and I are actually twins. You may not have noticed that, but it's true. So some people talk too much like me, and then some people just do all the work like George. So, you know, in that spirit, I want to recognize that none of this would happen without a number of people. Alicia's one of them. George is another one. There are a number of people in this room. I just don't know their name all, but my twin is certainly one of them. So please,
Thank you. And I just mentioned I don't really have to speak a lot, and I really did not follow up with Ms. Hoven said. She's the shining star of Guyana. She's the future of Guyana. And I just like to start the conversations by borrowing some words from President Obama and just say, yes, we can. Yes, we can bring down suicide. Yes, we can go forward and be a brighter future for me.
Thank you very much. I would like to just take a moment if there's anyone in the audience who wants to say something, but please be reasonably brief. Reasonably brief.
First of all, I thank the team who came from abroad and also those who are here. You are the responsible national for this issue, right? So now, let us start from now. I give one suggestion. If I go home now, on the way or somewhere on the road, if I find someone with mental disorder, if I want to assist him, it may be harsh. So what number we have, what authority we have to call them so they can respond to pick that person or help that person? Is there any mechanism from the ministry?
At the Georgia hospital before COVID, I know the social workers would normally go out and they will assist in that case with the ambulances when they get persons help. Post now with COVID, I don't know what is happening. I'm not sure. And also, I can speak with my own experience as well. From time to time, we used to send persons to the police to get help. But now the police are refusing to help because in some cases, the persons are violent or they're using weapons and stuff like that, and they're saying that they will get disallowed. But hopefully by next year, with the new legislation in place, we will be able to make some changes. I know you were making up your face, but at this point, we would have tried other mechanisms. It has not worked, but hopefully, December, January is going to be the new year. And so we're going to be able to look and to see what, use the legislation to put some better systems in place to address persons seeking help from mental health.
Just please mention your number and where to refer so we can communicate with you.
All right, so I am located at Common Street at the Ministry of Health Building, Mental Health Unit. 252 Common Street. My number there is 223-6626. 223-6626. And my cell phone number is 683-7188. 683-7188.
Yes, thank you very much. I'm from the, I'm on behalf of the religious community, with reference to what the minister said as well for me. For the training that has been provided, I'm making a call that the training should not focus on counseling alone, but also to provide the opportunity with more awareness before counseling. Because what has been happening anytime we talk about mental health, all we talk about is counseling aspect of it. And not like every community has workers we train. Not only should we do counseling, but also we should go awareness session. Like in the schools and community meetings and so on. So as to start taking up, because we have to create a national competition on mental health rather than waiting to do from a competition. Secondly, I'm the CEO of the Indigenous Peoples Commission, and we have been taking initiatives to also assist in terms of addressing mental health. Earlier this year, we could be here at the mental health unit to talk about mental health in the village called Malawi River. And in 2018, we also had another mental health workshop in Camera. And now that you're the national coordinator, we will of course collaborate with you. So next year, we have activities in the indigenous community. We welcome you to join our team to the next. Thank you very much.
All right, so pleasant good afternoon to everybody. First of all, Professor Hoven, and your team, I we all want to really thank you for the opportunity that you have given to all of us here, especially in this big broad topic of mental health. And so being here from day one to now, we've listened to all the various factors that contributed to mental health. Just to name a few that we is domestic violence, poverty, gender inequality, trauma, major physical illnesses, and so forth. And so we've learned too, to prevent all of this, that we need intervention. And this intervention is not only from one person, but the entire country and the world as an extension. And so we need to work on all of that. And from a religious perspective, we also engage in yoga. I will ask my tutor to come up a little later to see all about yoga. But hearing the good things about Alicia, and I found myself very fortunate that I was giving the phone number earlier, because I have a ready case for you. And then listening to our very own Henry too, you said that you love to be in touch and on the ground. So I'm ready for you too. All right. So with that being said, I will definitely keep in contact with you, because I have a case right now that need the attention. So hear me out. By the time the day is done, Miss Alicia, I will definitely call you, because we are in for action. We want to make a difference. And so together we can all do this. All right. Thank you very much once again.
So Vice President, I'm sorry, I would like to, you will get to everyone that wants to say something. But I think a couple of points have been made here that are worth repeating so that it's in the context of where we're going. One, and I said this on the opening day, I see this as day one, this conference is day one, for that national conversation. We've had lots of conversations, but I see us together having this national conversation. I don't want to leave here today, as I said, without having three, I'll settle for three, concrete tasks that we take on collectively. I have a list, but I would like to hear, I ask no more speeches. What I want to hear is suggestions for action that we can do collectively. You came up with a case, you told me about that case, I've already told you that she's already on the case. Action is what needed. So we hear something, we gotta do something, not just, oh, that's interesting. So now we've been talking all week. We have the religious community here making a tremendous contribution to our thinking and understanding how different perceptions influence who we are and what we do. We've heard all kinds of experts talk about different kinds of intervention, what works, what doesn't work. Here we are in beautiful Guyana. What are we gonna do now, starting now? What three things are we gonna do? I want to identify them one at a time. I want an agreement on it, and then I want to know who's gonna do it. So you're not getting out the door, the doors have already been locked. We're gonna do this together, and someone has to take leadership. And then other people have to get on the bandwagon, okay? So, I'll start. One of the things that Dr. Henry mentioned is about the community and using the model that was created for HIV. One of the things that we know so well is that the only way you're going to bring suicide rates down is if you focus on community. It cannot be every individual. It cannot be the professionals. You have many, many villages in this country. There's no professional in sight. There's no religious leader in sight. There's no one in sight. There's just a few people living together. So what are we going to do? So we talked to the people at the Bureau of Statistics about how we're going to get this information on every single community. We can get all that information, but we have to have someone who's thinking about focusing on that community, every single community. So Dr. Henry was brave enough, or stupid enough, I don't know, to say that she likes to see this model replicated from HIV, which turned out to be enormously effective in Guyana. So we don't have to invent the wheel, reinvent models all over the world, there are models here. You have one here that works beautifully in terms of the community. So I would suggest, and you could say no, I mean, do not feel that you have to agree with anything that I say. Nobody in my group agrees with me most of the time. So I would suggest that number one is that we develop a model of community that is built similarly to the HIV model that was used here. And I'd like you to comment on that if you think that's a top priority for going forward, that we use that model. Could you comment on that?
Sure, Professor Hoven. I still looking to see if Dr. Adu-Krow is also here from PAHO, because this is a model that the Ministry of Health crafted, and those persons who have been engaged within the religious community, they were a primary stakeholder. Civil society was another primary stakeholder. We have a lot of NGOs who are already established and still working in the area of HIV. They are there already, and so that the infrastructure is in place at the national level and in every region. Also, we have the Ministry of Health having centers, health centers, hospitals in every region. So those things are already there, right? But they alone cannot do it. You, as you correctly said, within the different groups, my friend here is another NGO, right? So there are all those different groups. We just need to, I think there is a national NGO forum, or I don't know how if they still work and what happens, but that is something that could be revived. Other than that, we pull in the new ones who are now new here. We pull those together, make a listing, and then we connect what we need to do and how we need to do it, right? So we have that to start.
Okay, we got number one. And number one has, I think you probably heard Dr. Henry volunteer to head that group. Did you hear that? Well, listen carefully. I heard it, and I think Dr. Wilson here also agreed. He's a medical geographer, and he's very playing a very active role with the Bureau of Statistics. We spoke yesterday about getting new data. I think everyone knows that the census is going to be done next September. So they are very active in terms of getting all the information about all the community. So it's perfect timing. So that's 2 committee members. We got a leader, we got a member, and we need at least 4 more people. Who's going to be on that committee? Okay, could you say your name?
South Texas.
Maybe you could send an email to Dr. Henry also. You know?
I selected to do it this time.
Good. Okay, the gentleman down there, let's go. Are you willing to be on that committee? It's not just willing to be on a committee, you gotta show up and you gotta work. So don't volunteer if you're not willing to do the work, because we're gonna hold you to the task. Next year, we're gonna see what happens, right? So you're volunteering, right? Great. So,
Could you say your name and the agency again?
I see you, Office of the Indigenous People Commission. As well as the religious organization.
He's gonna volunteer for something too, what? No one gets out alive. So we got 1, 2, 3, 4 members. You need 8 members on a committee. So we got 4, we need a few more. Okay, can we get your name?
My name is Ramona Georges, coordinator of the Guyana National House.
We got another gentleman back there. Well, I don't know his name on it. We want to get the work done. That means women have to do it. Come on. That's the best to get the work done. And there's another thing, wow. So that's something we have. Everyone needs to send an email to Dr. Henry. Just send it to the conference email and say that you're on that particular committee board forward. Okay, we're a third of the way there. We need 2 more projects. Come up with one. All right, here's mine. One of the things that we know is that just like you asked the question, what do you do with this case? You asked the question, sorry for pointing, but you asked the question, what do I do? Well, if you're in the community and you're not sitting in this conference, you're asking the question about yourself. How do I get help? Where do I go? Where is a facility that will deal with me and my problems? What's a telephone number? So we know from doing lots and lots of studies that one of the things that's most helpful to people when you go to their house is you leave a booklet with all kinds of information that people don't have. Many people, particularly in the hinterland, they are not hooked up to the internet. They are not going on searching for help. They need help and they have no idea how to get it. So we were thinking, okay, we would come up with a booklet when we're doing our national survey starting in January, which is 5,000 people. That's what we would do. And then we realized that's too limited. You're going to do the census in September. So we talked to the Bureau of Statistics, and would they be willing to take an informational booklet about mental health, suicide, trauma, injury, etc., and leave it in every single house, right? 780,000 households in Guyana. And they said they would. So we're going to do it. But that means information is very powerful. And if we don't give people the information, we're not going to have 780,000 people calling Alicia. But we have to have a system where people can make phone calls, get information, and they know where to go. And the only way to do that and to do it for everybody is to put it in a booklet. So we need to create that booklet. So we need some people to do that. Who's going to do that? Okay. So there's one lady here with a blue, and she's got a blue mask to match, and blue shoes. Brittany. And we have another person over here. And we need 2 more. Okay, that's blue. You hiding under there? That's blue. Thank you. We need 1 more. Noel over. Okay, so we got 4 people to develop a informational booklet that will be relevant for every region, all 10 regions, but it will also be relevant for a national perspective. And as you know, when people have mental health problems, they like to go somewhere else. And if you don't live somewhere else, which is why you're going somewhere else, you don't want people to know that you're going, you have no idea where to go. So if we give people information and we give it to them by location, they can decide where they want to go. And of course, one of the problems that we've talked about here is there aren't enough places. But that's what we want to do. When we develop this booklet, we're going to see where we have deficits. I mean, you know that when you've got out where there are deficits. But when we lay it out, we'll have a directory this year, and it will be better next year. Because one of the things, according to what Minister Anthony said, is he's going to do a lot in terms of the community of the hospitals. So So there may not be a psychiatrist in the hospital today, but according to what he said, there will be one there soon. So we can't list it today, but we can list it soon. So we won't put this directory out until September, so everyone gets a chance to add between now and September. And then we'll do it. Okay, what's the third thing we can do? Come on, we got the coming here. Give them something to do. What's a third project we can do that we can hold ourselves accountable, that's going to make a difference in people's lives, that we can assess how well we've done it next year, and in fact is going to save lives between now and next fall. What is the third project? I gotta come up with all the projects, come on. All right, I'll come up with another project. Another project is what Minister Anthony suggested, and that is that we do something with all the fantastic stuff that was presented in the last 4 days. That we put it together, that we put abstracts together, or we put all the videos together, or we do something. And somebody needs to think about what that something is, and then do all the hard work of putting it together, so that it becomes available, and we can send it out to everybody, and everyone can read it. As he said, you couldn't be in 5 places at once. Judy Rich back there was very, very good at being in all 5 places every time. We had every second. She managed to get to all 5 meetings every time, but not everybody could do that. So if you put the stuff together and make it useful and available, there are things that you didn't have an opportunity to do. So who are the people who are going to be doing that? Okay, people say their names. Thank you. Can I hear another one? Can I hear one more name? Jessica? Justine? That's 3. Harmony? 4. Well, it's a big job, so we need some help. Come on, we need 2 more people. Megan Ryan? Judy Rich. We got 4 outside. I need 2 more guys. Did you say your name? Wow. We got 2 child psychiatrists on the team. That's fantastic. The only 2 child psychiatrists. And they're on that team. That's wonderful. Thank you so much. And there was one more thing that's so one more hint. One more hint. Okay, here we go. What's your name? Thank you very much. Okay, so now we have 3 projects that we're going to hold ourselves accountable, and each one has a chair. The first one, Dr. Henry is going to chair. Who's going to chair the second one? So that's for the second one. The third one is the document. You're volunteering to chair the third one, right, Jessica? Okay, so we got a chair for the third one, Jessica. The third one, and the second committee, who's going to chair that? Dr. DeBlue is going to chair that. Okay, so that means the 3 chairs are responsible we will get you the people's names and emails and send them to the chairs. And the chairs then need to have meetings and they need to produce a product. And we want to see a product by the end of end of November, right? So what about the end of January? So you can work on it during the rainy season, and when you're sitting in the puddles, you can work on it, and we'll see something, and you can circulate it. You can create a list to circulate it, so people can give you feedback. But we want to have these done, so that we can get them out into the community by the end of April. Okay? And the directory will probably give some more time because we don't want to have it done too soon because we're not going to go through the census for September. So that's great. You got 3 projects, 3 committees, 3 chairs, and members on every committee who have committed that they're going to do something. Right?
So, yeah, the directory, you know, I think the directory is going to evolve over time as more services are included. We could continue involving the directory. But the reality is that our national study goes to the field mid-January. So I think it's critical that we have at least a draft of the services that we know of by early mid-January, so we can at least start distributing that once we do.
Okay, good idea. So the directory, if we could get the directory, an initial draft by the middle of January, by the 15th of January, we're gonna push a little harder. It's not gonna be complete, we know that, but something, because we are gonna go into 5,000 households. Right? So that's 5,000 households that will get something. And then in September, everyone else will get the completed document. But let's do what we can when we can do it. And George's point was well taken. 5,000 people is better than nothing. So let's do that in January. And by January 15th, we will have that. Now, the other thing that we need to be clear is that we are, you know, in this together. And who is in this together? Well, it's the university, and I think you've seen Dr. Henry to step forward. We had Minister Anthony here from the ministry. We've had other people from different ministries here. And we have Dr. Cummings over here, who's always reading emails, and he represents the university. He's a busy man. We're very, very lucky that he has given us so much time this week. He's always running back and forth. So I certainly appreciate all the time he's given us. But those are 2 huge organizations, the university and the ministries, lots of them. But there are all of the grassroots and local groups that you represent, be it religious groups. We need you. We need you at the table. We need NGOs at the table. We need everybody at the table if we're going to have this conversation. So I would suggest that we also, out of this group, if you're the group, if you're here, you want to do this, that we identify 10 or 12 people, because people are busy and they can't always be there, who are going to, on a monthly basis, and we can agree whether it's the 3rd Wednesday of the month, that we will have a Zoom call and we will check in. And part of that checking in will be that the 3 chairs will be on that Zoom. That's 3 of the 12 people. And then the rest of us will be whoever we are. But we got to make that appointment today. And we are going to be the national, whatever, we got to give ourselves a name. But we are going to be the national think tank of reducing suicide for Guyana. And so we got to have 12 people at that table, right? At least 12. So we just identified 3 of them. They are the 3 chairs. Who else is going to be at that table? We got 3 people right here. You say your name? Sorry? Right, so there's a concern expressed on Zoom, that we don't have adequate representation from the hinterland. So I think, our gentleman back there, we need to vote him in for something else, because he does represent the hinterland. And if there's anyone else in the audience, or we have to go find someone, but we do need certainly to have good representation from the hinterland. So how many do we have now? Well, okay, so we got the dirty dozen, and the dirty dozens, wait till the start, and we'll have our first meeting on December. What about the 15th of every month? Does that work for people?
Okay, so this group that's going to get a name for itself when we have our meeting, the first meeting will be the 15th of, can you hear me? The 15th of December. And of course, what we will do is we will invite other people like Professor Cummings, like Minister Anthony, different people, Dr. Henry, who's got to do double and triple time. We will invite people to come to different meetings, but I don't think it's reasonable that we expect them to be regular committee members, because they're keeping the ship afloat. And our job is to,
Our work and to report your
going to go on. We have started a new center at the university for trauma and injury prevention. Triple time now, I'm talking triple time. So there are many, many things that are going to happen, and I encourage all of you to not only work on the committees that you have volunteered for, but to contact any one of us, any one of those committees. If you get home tonight and you realize you really should be on one of these committees, let us know. Let us know. We need you. There's no way any of us can do this alone, and we can't all do it with just a couple of us. Everybody has to put their heart and soul into this. Okay? So that's what I have to say. And Dr. Cummings, thank you.
Someone else from
Paloma?
Okay, so the Vice Chancellor of the university is saying that the Cobres, COBRES, will volunteer to be a part of the think tank, and the persons that are joining is the dean and the assistant dean.
Did you get that? Yeah, great. Okay, so they're closing in on us. They're, the big time are joining the group. So we're very lucky. Very lucky to have so many people at the university and so much leadership, both at the university and in the ministry, who are willing to do their part. We all have to just work together. And I'm really grateful for all the leadership that's been shown by the university, by the ministries. It's just outstanding. And all of you here are just great. I want to give Professor Cummings a chance because I'll be in trouble if I don't.
What should I say? Afternoon, good afternoon. I'm sorry, so many duties and activities, and certainly as a nation, we certainly need to thank Columbia University, the leadership that is provided through this project by Professor Christina, and her team, Dr. Musa, and as she's indicated, that the university, Vice Chancellor, in my capacity as Deputy Vice Chancellor, Dr. Henry, who's a Dean of the Social Sciences faculty, the PI from the university, Dr. Hoven, the Minister, Georgetown Hospital, the three major key stakeholders that, and certainly, as I said at a previous discussion, that the university respond when it was established in 1963, part of its remit was to answer questions and resolve issues that are of national interest. And that is exactly what we're doing. Appreciate all the volunteers and please, sometimes our adrenaline is up, we're all excited, and tomorrow we forget. This I don't want us to consider this as a talk shop, but as a workshop, right? Many times we have talk shops, let us be a workshop. And the figures in Guyana are not figures that anyone would be proud of. And the core group, all of us here, we're fully committed. We're fully committed to this. And the energy that we have now, let us keep that energy level the same way tomorrow, next week, next month, next year, until those numbers come down. And certainly whatever achievement we would have as a nation, this model can be replicated in other parts of the world. And that is what research is all about. That's what these sort of interventions, where other countries, other nations, other jurisdictions can benefit from the success story that we will have in the next 4 to 5 years. And so I wish all of you the best. We don't have, Christina is now Guyanese. I'm certain she has to be Guyanese. She has to be Guyanese with the amount of effort and energy that she continues to put. From the time we met her, the adrenaline is always there. We never had, it's always there. And so we're very grateful for her commitment because the university collaborating with us, and there's so many benefits from a university standpoint, but more so, what is more important is benefit to the nation, to our people. Safer society, violence, homicide, unintended injuries, right? All of those things that haunt us for many years will soon come to an end. We we've just established a school of the College of Behavioral Sciences. We started the program in psychiatry. We have a bachelor's in psychology. We have a master's in psychology. So we as a university, we are strengthening the behavioral sciences. We are providing the skills that will be out there to address these issues in the early stages. And so once again, I just say on behalf of the university, I wish to thank all that has happened within the last 4 days. And please, let us don't lose our vision, our energy. Let us keep that energy level up, please. And our commitment that you've made today was seen by God. He was seen by Allah. Wherever your God is, He's seen it. And it's been written down, right? And your commitment. And so I I just want to ensure that it's captured by video. So let us make that effort. All of us and because we can even thank Columbia University, um, um, led by Professor Hoven and her team for the enthusiasm, the interest, and the support that she's given to us. And let us make a difference. Let us make a difference in this beautiful country that we have. Thank you very much.
Thank you very much, Dr. Cummings. I just want to say a few words about what is already in place and what people might think of in terms of joining other activities. One is we have a new center at the university. And as I said, the university has been outstanding in their support of all of the work that we're trying to do. Dr. Paloma Martins, Dr. Cummings, Dr. Gobin. We have a new center. It started October 1st. And that is a center of training. And so if any of you are students or you know students, it's an opportunity to get trained in trauma and injury prevention, which is all part of the suicide spectrum. So Professor Martins has been very, very clear that she's very happy to support this center. Not really a center, it's a program, but we want to eventually turn it into a center. We have Dr. Martin's support for doing that. We want to make it bigger and better, and we want it to reach all corners of this beautiful country so that we can train people. So that's a training opportunity. We also have all the research activities that's primarily at the moment coming through the ministry. And again, you can talk to Alicia. There's an opportunity there. But if any of you are already students, are already thinking about how you can engage in research, contact us. We are going to be, getting nationally representative data. It needs to be analyzed. We're going to have a whole wealth of data. There's hundreds of papers to be written, and it's your country, it's your data. We will work with you. We're not running off with your data. We want you to write those papers and to publish them. And one of the things that the center is going to do is to help people do that. And so the people all involved in the center are going to make that happen. So, there's lots of different avenues for you to get involved. So I don't know what time we've gone over by half an hour, which is nothing unusual for us. But I think Dr. Adu-Krow just came into the room, and he doesn't even know what's in store for him, what we've lined up with him and Dr. Henry. But I just want to take this one last moment to see if there's anyone who wants to make an additional comment. We've made a lot of commitments here today, and I know we will fulfill those commitments, and that we will have a lot more to say and do for next year. And I want to ask everyone to think about the conference next year. At some point, I'm not sure exactly when, we will start making the plans for that conference. So if you can just respond to the conference email if you're interested in helping with the planning for that. We haven't figured out yet when or how or what. We did this with zero money. We did it out of our back pocket, as we say. hopefully by next year, we'll have figured out how we can get some money to support it. But I would ask anyone that's interested in working on next year's conference to just send an email, and we will incorporate you in that process. So there was a question in the back. Yes, hi.
Hi, I'm Jessica Young.
Can you come up and get the microphone?
I was an accident here. I just happened to be outside the Pegasus and I met these two wonderful people and they invited me here. And it's been a transformative experience. I'm actually involved in a project about suicide prevention. So it's very, very opportune. But the thing I want to know is, I know that what works in England incredibly well is the Samaritans, which is a hotline that people can phone. And I also attended several sessions here where young people who are particularly affected text in America because that's where they feel comfortable. They don't feel comfortable with a spoken word. And I want to know if there was any plans afoot to start such a hotline, because I think it's really important.
Yeah, we got through 3 projects, and that was our goal for today for getting the work done for next year. But doing a hotline, doing a national surveillance system, those are all things that we're working on. I don't want to be, there's an expression that the glass is half full or half empty, and it depends on how you look at it. So the people in my group always say that Hoven's overflowing. So I'm neither half full or half empty, just overflowing. So I have to contain myself. So I limited us to 3 projects. But certainly a hotline, a national surveillance, those are also being worked on. And I can ask George if he wants to speak to that. And again, if people are interested in those particular projects, send us an email. But we are working on them. I just didn't want us to say we can do more than we can do. And I think 3 projects and all of your work on those 3 projects will make a world of difference. We will be, huddling along trying to get these other things going. And next year we can get more people involved in more projects. But let's try to stick to our 3 projects and really make a big difference. George, did you want to say something?
Sure. Yes, we definitely have plans for creating a national suicide surveillance, disease surveillance, whatever you want to call it. That's going to take time. To address the issue about texting and for the hotline, that is also, we're still in discussion. We just started the discussions. That's going to take time. We do have a wonderful Facebook site and Instagram site that for the conference that Ms. Jessica, Anthony, and Justine and Harmandeep have put together. And we have a wonderful video library. Not only all the videos from the conference that we've been recording all the Zoom. If you logged in on the Zoom, you always hear that this is being recorded, right? That we're going to edit those down, obviously remove some of the technical issues as much as possible, and we're going to put them on the Facebook site. And hopefully that social media campaign can grow into something more where folks can then chime in and possibly text through the website. We don't know. We have absolutely no funding for anything like that. That's going to take some substantial resources, but we can definitely try. The one thing that I do want to challenge all of us, and this is a very simple project to do, and that's for all of us to start changing our vocabulary. There's a big push in the United States and elsewhere of stop using the words committed suicide. The word committed suicide implies that it's a criminal act, and it's not a criminal act. Someone has died by suicide, a death by suicide, it's okay. But committed suicide, completed suicide, those are words that we should strike from our vocabulary, and we should, take this and spread that word and spread that message to all of the communities. Because, decriminalization of suicide is going to happen here in Guyana fairly soon, but we have to start changing that vocabulary so we can start changing behavior.
Okay, just to say quickly, we already have the National Suicide Hotline. So while we wait on George and Christina to create something else so we already have the National Suicide Hotline, and you can also text that number or WhatsApp. So those numbers are 223-0001, 223-0009, 623-4444. 600 4444. So again, the numbers are 223-0001, 223-0009, 623-4444, and 600 4444. Okay. 223-0001, 223-0009, 623-4444, and 600 4444.
No, oh,
Yes, I just want to again acknowledge Alicia's a walking support system, and you know, turn to her, use those numbers. She will be your answer, and she's there. So thank you very much, Alicia. Yes.
excuse me.
Thank you. I don't know if this would assist us, but the Global Plan of Action for 2030, for 2021-2030, it's calling for a global emergency number, like the 911 number. So it's asking all countries to come up with a global emergency number. And seeing that we're here, PAHO WHO, we're working towards, that's one of the priority areas for this year, to come up with a global emergency number like the 911, where you can just dial 911 and you can get any emergency system. Just so now that we are here and we are hearing about the emergency for the mental health, we will try to incorporate that into the global emergency number. And also, we'd like to be part of the Center for the Trauma and Injury Prevention at the University of Guyana.
Fantastic. As I said, it's currently still a project, a program. It's not an official center. It's a goal to make it a center. But whatever it is, we're happy to have you involved in it to help us turn it into a eventual center. So thank you very much for that information about the global number. Is there anyone who wants to make any more comments?
And also the mental health unit also have a psychosocial support hotline number, and that number is 655-7233. You can call, you can WhatsApp, you can message.
I have something to say.
655-7233.
Who wanted to say something?
I'm Miss Melanie from the Suicide Prevention Helpline. Good afternoon again.
Yeah, go ahead.
Yes, our toll-free number for the suicide helpline is 600-7896. That is also on WhatsApp. So they could get us on that number as well. It's a toll-free number.
Could you repeat that number?
600-7896. As long with the 623-4444, that's our number as well.
Right. So I hope everyone was able to get all these numbers down, but you also see that it's part of the problem is that, you know, if you're a person in the community and you're in trouble, to sit there and try to figure out which number you should be calling is a real challenge. It's a real challenge for me listening to all these numbers. And, you know, if I'm out in the hinterland and I'm in trouble and I want to hurt myself, to then have to go through a set of numbers is not a good idea. So that's one of the things we need to do. We need to simplify and make as much service accessible to people as possible. So this is one of the things we need to look at. So did anyone else have any comment? Yes, sir.
Thank you. I'm very happy to hear that for the next program that you have, you're already planning, and we can be able to contact somebody with regards to that. I have had a problem because when I got to hear about this program, it was late, I think, right? And I tried to call to contact the to email, but I never got a reply. What I'm saying is that I am a member of Science of Spirituality Meditation Center. It's an international body. Our head office is in America. We have persons who are very much adepts in meditation, and they're associated also with psychiatry and medicine. Meditation is being applied in therapy throughout the world. And we thought that maybe we could share some perspective, right? And the person who I'm speaking about is adequately qualified for that purpose. So I'm very much happy that I'll be able to contact you before the next program, so as to give him a chance, or to other members a chance, to make a presentation in regards to that, because this has to do with stress management. The body problem and the mental problems or worries can be controlled by meditation. So we would like to put that on the syllabus. Okay.
Thank you. Thank you very much. And I think we have someone here who very much wants to get discussions about yoga, which I hope we'll have. I don't want to. It's always good to apologize, and I will apologize that we put this conference together in a matter of weeks, and that meant that we were not able to ask all of the people here and throughout the world to contribute their suggestions about what ought to be in the program. We put it together very rapidly. I think it turned out to be quite successful, but it can be so much better next year when we open it up and ask all kinds of people to contribute. So absolutely, I do apologize that it got done so fast, but I wanted to beat the rainy season, and I also wanted to get out there as fast as we could after October 1st, when our program at the university started. So it all came together very fast. And again, I do appreciate that everybody jumped on board and has helped us so much to make this a success. So if we don't have any other comments, then I think we've done our job here. And I just want to add one last remark, and that was what George referred to, and that is the exceptional work that was done to collect powerful, important, good videos from all kinds of sources around the world. And they have been put together now, they're categorized, and we want that to be a national library that you at any time can access it, and you can suggest other people access it, whether they're people who are in need or just people who want to get educated. We are going to leave that as a national library, and we will build on it next year. We will collect new videos and put them together. So they are available to the university, they're available to professors, they're available to you as you run groups. You may find videos in there that you want to use for focus groups in the community, or for conversations, or in group therapy, however you want to use them. They went through a tremendous job of selecting very good educational videos around all kinds of topics that we've talked about here at this conference. So they are available to you, and we'll send out all that information so you'll know how to use it, how to share them. So that is something that we are very happy. Okay, All right. So again, anyone else have a last minute comment? Okay. So thank you very much. This is the end of the first year's conference, and I wish you all a wonderful, wonderful day and a wonderful year. And thank you again so much for all your work. And I look forward to working with all of you during this next year. And we will do better. We will do better. Wow. Good job. Really.